Hi, Christian. So we are already here. So whenever you can start this session. Welcome, everyone. Christian, can you hear me?
Yes, I can. Welcome.
Okay, good. Go ahead.
Thank you. Thank you very much. No, welcome, everyone. And we're going to have four speakers in this breakout. And I really want to encourage discussions, input, and questions in the chat. And let's see if we can get a little bit of a conversation going. So we're gonna open with Moscow, Russia, with Faina Filina on how we can use healthcare in clusters. Go ahead.
Hello, can you hear me?
Yes, we can.
Yes. Hello, colleagues. Thank you very much for the opportunity to speak at such a well-known international event. Nice to meet you here. My name is Faina Filina, and I'm the director of the international cluster in Moscow. Today, I'd like to tell you about how we acted in the face of the pandemic and how we contributed to improving the healthcare system through international collaboration. Firstly, I'd like to ask Kalina to switch on the video about our project. Can we do it?
Sometimes, even small cause can lead to significant changes. The Moscow government is building the medical cluster that will unite in the same territory leading clinics from all over the world, from Israel, South Korea, France, Spain, Japan, and many other OECD countries. The best foreign medical practices will be presented in Moscow. Russian patients will have the access to world-class medicine in the most socially significant areas. Russian and foreign specialists will have the opportunity to exchange their knowledge and initiate advanced medical research. The Moscow mayor, Sergei Sobyanin, noticed that this is a significant project for Moscow. The cluster will provide training for doctors of city hospitals and outpatient clinics, and advanced technologies to be used in the cluster will be then implemented in everyday practice of Moscow healthcare. Looks fantastic? It is real. First steps have already been made towards transformation of healthcare. A federal law creates special conditions in the cluster. Foreign clinics can apply their own treatment protocols and medicines and invite foreign specialists without any quotas or job permits. The first facility of the cluster has already been built. It is the diagnostic center of the Israeli clinic Hadassah, with the modern simulation center for education of physicians and nurses. In 2021, Hadassah will open the inpatient clinic of 20,000 square meters. In 2022, the first patients will visit the South Korean Smart Hospital of the Future, Bundang, for 260 beds. In the same year, the launch of the French Center of Medicine is planned within the area of 15,000 square meters for 40 beds under the governance of Strasbourg University, and a large educational center with various programs for physicians and nurses. By 2029, the cluster will host 10 to 15 leading foreign clinics from Israel, South Korea, France, Spain, and other countries. There is all needed infrastructure in Skolkovo Innovation Center for comfortable accommodation of patients and staff, housing, school, kindergarten, hotels, and apartments. All this will be located only 40 minutes from the city center of Moscow on 57 hectares of the Skolkovo Innovation Center. The Moscow International Medical Cluster. Let's transform healthcare together.
Thank you. Can I see my slides? Lina? Thank you. So the pandemic forced some adjustments in the activities of our cluster, and we faced some new challenges as all organizations in the world. However, we didn't stop. Moreover, we decided to discover new areas of activity, and this allowed us to create social positive changes in the healthcare sphere. Next slide, please. You could see the video about our project. International Medical Cluster is a medical, educational, and scientific platform created by Moscow government with the aim of attracting the best medical technologies and practices and to facilitate the exchange of knowledge between Russian and foreign specialists. And our activity is regulated by special federal law, which allows to apply the registered licenses from OECD countries. I mean, medical protocols, medicines, medical devices, and etc. Next slide. And next slide, please. By 2029, on our territory, 10 to 15 medical organizations, foreign clinics from OECD countries will be located. And we estimated that about 300,000 patients would be able to receive advanced medical care annually in the clinics of our cluster. Next slide, please. The first member of our cluster is Israeli Hadassah Clinic. It's well known for its effectiveness in the treatment of cancer. And the first facility of the MC diagnostic center managed by Hadassah Clinic. Other facilities of the MC are under construction now, so only this building, only a diagnostic center works. Next slide. It is the plan of our cluster with all our, not all, with the members that we have now, that we plan now. We have only one building. Next slide. Other facilities of the IMC are under construction now, and during the pandemic time, construction of the facilities was proceeding according to the schedule. But we had certain difficulties in finding some new members, foreign clinics in this period, and therefore we have launched several new directions related to the pandemic. First of all, next slide. COVID-19 antibody tests. Hadassah Medical Skolkovo, our first clinic, was among the first medical organizations in Russia providing tests for COVID-19 antibodies for mass market. It became possible because Hadassah used tests from Singapore with certification confirming production that complies with safety standards in accordance with the requirements of the European Economic Area. Next slide, please. Online conferences for doctors. The IMC has a wide network of foreign experts from our partner clinics, from our members, and we decided to use this resource to help doctors, Russian doctors, to fight coronavirus. So we organized 5 international online conferences with the aim to exchange knowledge on COVID-19, and experts from 15 countries took part in the discussion. We worked in collaboration with the Moscow Health Department, and about 8,000 medical workers participated in our events. Next slide. We also organized a simulation center with latest robots in the largest Moscow COVID-19 hospital, and medical workers who treat patients with coronavirus practice the necessary skills in safe conditions on robots. More than 400 medical workers were trained in this simulation center. It is still working in this hospital because now situation with coronavirus is not so good. And next slide. With the help of our international experts, we prepared several analytical reports on epidemiology and anti-COVID-19 measures in foreign countries. And we also analyzed Moscow measures, compare these measures and make some conclusions about effectiveness of these measures. These reports were published with free access in federal media, and more than 200,000 views in media we have. And also, next slide. We prepared our experts, led by the CEO of the MC Foundation, Eldar Khairulin, with 15 years experience in healthcare management. We prepared the review of recommendations for clinic managing large patient flows during pandemic peaks. It was also published with free access, and we are planning now to continue this work. And next slide. In the conclusion, I want to say that this period, this difficult period for all countries, for all, I think, spheres, for all organizations, this period demonstrated real need in international collaboration. And international medical cluster in Moscow has become really consolidation point, really platform of the best international practices on COVID-19. And we think that the main factors that helped us, that allowed us to create social positive changes are our members, foreign clinics from OSD countries, international experts, our from also partner clinics, and our close cooperation with the Moscow Health Department. So, last slide, please. If you have some questions about our project, you can contact me on contact details on this slide. And I see some questions in chat. Can I read them, or I should answer after all the presentations?
So I suggest we have a little discussion on those at the end for everyone.
Okay. Or I can text the answer in chat.
Of course, please do. But thank you very much. And it's a very impressive story you're sharing.
Thank you very much for your attention. Thank you.
And of course, with our first speaker joining us from Russia, we have speakers from Australia, from Mexico, but our next speaker is going to be joining us from Spain. So please say welcome to Nina Hoppmann.
Hello, Christian. Hello, everybody. I'm very pleased and very happy to be here and to share with you an initiative that we created from the cluster IDEA here in Spain, in the Spanish region of Aragon, which is located in the northeastern part of the country. And just to give you a little bit of context, on the first slide, please. IDEA is an ICT cluster in which I'm the cluster manager from the Spanish region Aragon, and we are here based in Zaragoza, in the capital of the region. It has 71 members and partners and a grouped net billing of 17 billion euros. And what the cluster mainly works on is to increase the growth and competitiveness of its members with a focus on ICT, so on information and communication technologies, joining both suppliers and users. And for this, we take a cross-sectoral approach to promote digital capacities and services. And what is also important for the initiative I'm going to speak to you about is that we hold the presidency of the Spanish National Federation of Clusters, as well as the presidency of the European Clusters Alliance, which is an alliance to bring the national associations from Europe together and represents together 740 clusters altogether. And what might be interesting for you to understand the initiative is that we're currently working intensively on 2 projects in collaboration with here the regional employment service in Aragon to skill employees in the region, one for young professionals to find employment in the ICT sectors, and one for employees who are already in jobs to acquire new skills and improve the job situation. And in this conference now, we're talking about tackling the challenges ahead. And one challenge that we're definitely facing when recovering from the COVID-19 crisis will be employment, since many businesses had to stop their activities because of lockdowns or had to reinvent their activities, go digital, change their supply and value chain. And this has an important impact on the labor market. Also possible to lead to unemployment or to the need to re and upskill people, as Sandy from Detroit has also talked to us about earlier. So this is why the initiative Sumando Empleo Aragon, which translates to Aragon adding jobs, was created. Next slide, please. So what is the initiative? We're talking here about a public-private collaboration platform which unites different entities from all over Aragon to strengthen the employment development and the entrepreneurship throughout the region, both in the urban and rural parts of the territory. And the collaboration started on the 9th of April, when our cluster IDEA reached out to public and private stakeholders working on employment and entrepreneurship to exchange information on the effects of COVID-19 on the labor situation and to find ways to support the people. And why did IDEA reach out? Next slide, please. We wanted to bring coordination activities to a regional level, because IDEA is involved in COVID-19 related activities on a European, national, and regional level. So on the European level, through the European Clusters Alliance, we initiated the creation of the European Alliance Against Coronavirus, which is a high-level expert group of clusters and many other entities who have been meeting since March, when the COVID crisis started, to exchange information, to adopt good practices, to help each other, to propose solutions for disruptions of value chains, and currently working on proposals for the recovery of the European industrial ecosystems. And in the spring, what was also another main topic was the supply and production of PPE, of personal protective equipment, including masks, but as well the design and production of respirators. So on a national level, IDEA brought together universities, clusters, and also representatives from the makers community, so the civic society, who have all been working on the supply and design of PPE to spread it across Spain. And we asked, what can IDEA do on a regional level? And as we are involved in those 2 programs to skill and train employees and to prepare them for the digitization and new job opportunities, we created this public-private platform to bring together the relevant stakeholders in the region to intensify our work in this area and to help people on the labor market, which is becoming increasingly difficult due to COVID. Next, please. So the mission of the initiative is to involve the Aragonese society as a motor and agent of change. So we want to cooperate for the common good and for the economic reactivation and give priority to the equality in all its aspects and areas so that nobody is left behind. Next, please. The initiative is a bottom-up movement, so it was created out of the voluntary activities from different entities that you see here, both from the public and private sectors. We have city halls, we have consultancies, we have counties, we have our cluster, we have many foundations and individuals who are experts in counseling and providing professional orientation, and a private training center. And all of these entities are motivated to voluntarily invest in the capacity of the people here in Aragon. And what does that mean in concrete and for the concrete activities? On the next slide, you see the 5 working groups that they're working on. So the first one is working on a resource library to share among the group all the current and relevant information on the job market, on events, on courses, job offers, and support entrepreneurs so that we create synergies for the respective work. The second one, working on the public and private collaboration to make a dissemination of the activities. Communication is very, very important also in this aspect, to bring new agents to the platform, to inform different entities about the initiative, and to spread the word about to grow bigger and to consolidate the efforts that are being taken. Digital skills is the third one. So this working group is working towards filling the gap, the digital breach in the society, through training that they're currently preparing, but also organizing donations of technical equipment, distributing them to the people, or to organize, make it possible to use technical equipment that is available in different centers so that people get access to them. The fourth one, the development of employment and rural entrepreneurship, especially for the rural regions here in Aragon, to make the opportunities visible. The visibility is a very important aspect, and to make the access to services that are provided but not known of easier, so that the rural regions are strengthened. The last but not least is counseling that's directly directed to the persons as an additional service to the public structures that are already in place. So the main benefits of the initiatives have been so far and will be to bring together the different stakeholders for the good of the society. We have exchange, we have agility, which is much more flexible than some public administration structures can provide if they act on their own. And most of all, we have the motivation to act in this initiative from the bottom up that lead to an improved service and support to be employed or to start a business, to individual counseling, and to at least achieve the common goal to bring the employment support to the entire region to create an equality of opportunity. I hope there was a little insight about the work we are doing here. And if you have any questions on the last slide, you see my contact information. Thank you very much for the attention.
Thank you for sharing, Nina. I'm very glad to get stories like these from Moscow and from Spain. And next, we're going to get a good story on leadership all the way from Victoria, Australia. Good evening, Dr. Nicola Watts. It must be middle of the night for you.
Good evening. Yes, it's almost 3 a.m. in Australia.
Yes.
So got a very strong cup of coffee here, but thank you. Great to be here.
It's great to have you, and I'm just so impressed you're joining at 3 a.m. So the floor is yours.
Thank you. So yes, my name is Nicola Watts, and I'm a former cluster founder and leader, but now focused on facilitating collaboration, co-innovation, and capacity building. So I'm pleased to share with you some of my learnings and work. Next slide, please. I'm not going to talk today about a specific initiative, but I'd like to briefly talk about the challenge of leadership in general. In line with this year's conference theme, and in order to tackle the challenges ahead and lead social change, today more than ever, we need leaders to lead. But what kind of leadership is required? In the words of Otto Scharmer, traditional, individualistic and hierarchical approaches to leadership appear to have really hit their limits. We need more collaborative and collective approaches to leadership to really deliver positive impact. And clusters and people working in clusters and across ecosystems can and are playing a really important role in this space. Next slide, please. In this slide, I'm just wishing to highlight the very crowded space of innovation ecosystems in Australia. There is a lot of great stuff happening here, but often it is very fragmented and very siloed, which results in a lot of duplication, unnecessary reinvention of the wheel, and lots of gaps. And therefore, there's lots of wasted effort and investment that is not maximising and realising the full potential impact. How is it in your countries? Next slide, please. So I think we'd all agree that clusters play an important role in integrating all the actors in the ecosystem and are real bridge builders. Clusters join the dots, and they do this through the soft capabilities that underpins them: the connections, the collaboration, the co-innovation, the communications, and so on. So again, in the words of Otto Scharmer, leadership is a distributed or collective capacity in a system, that it's not something that just individuals do. This means that rather, or on top of a common focus on developing individual leaders, we need to develop collective leadership capability. It doesn't necessarily happen by itself. Next slide, please. So some of my work, current work, is very much focused on developing collective leadership capability. And unfortunately, I don't have time to go into this in detail here today, but there are 6 key principles which we are focusing on. And I'd like to just give you an insight into these and pose some questions for you to consider as cluster managers, although I'm sure many of them will be evident in the stories that we've heard here today. The first one is around ensuring unity of purpose. That is focusing on how we're addressing the wicked problems that we face and developing shared goals associated with positive futures. So my question is, how are you and your clusters unifying stakeholders around a shared purpose? How are you navigating the different needs and expectations of all the different players within that? The second one is understanding your context, which requires skills in systems thinking and the ability to recognise complexity. So my question is, how well do we actually understand our own ecosystems? Thirdly, and the third point is around a generosity and openness of spirit and action. Genuine kindness and empathy go a long way in today's world. So we need to ask ourselves, how are the trust levels across our cluster ecosystems? How do we measure them? The fourth point is around the importance of language and stories. There is that common saying, change the story and change the world. What impactful and inspiring stories are emerging from your cluster that are not nudging the way forward for a better future? Are they being told, and who is telling them? The fifth one is around exploring different ways of working and organising. It seems we still have a tendency to organise ourselves in a way that was suited to previous industrial eras, not this digitally connected and disrupted world we inhabit today. So how is your cluster co-creating new ways of working and organising to deliver shared value? And finally, the final point is around this shift from the ego to the ecosystem. And I think we would all agree that there's no room for ego in a cluster manager. It's not about the cluster manager as an individual. The cluster manager is the connector, the relationship builder, and the capacity builder across the whole cluster ecosystem. So in your cluster ecosystem, are there dominant voices and power agendas, or is there an environment of true diversity and inclusion? I'm sure many of these principles, as I said earlier, are embedded in the amazing cluster stories that we've heard at the conference, but it's always good to ask, what are your strengths and what could be strengthened? Next and final slide, please. So I've always seen clusters as umbrella organisations that operate across ecosystems, and they can play a really important role in building collective leadership capacity rather than just being the collective leadership. So my final question is, how is your cluster building that collective leadership capacity in order to join the dots across the ecosystem and build a better new normal? So I hope I've given you some food for thought, and I'd love to chat further and hear your stories. So if you're interested in exploring further, please reach out to me. And next slide, where I've got my contact details. Thank you.
No, thank you, Nicola. You should be getting some sort of award for longest running working day for a TCI conference. This is superb. But also thank you very much for highlighting that importance of the collective leadership that is really needed in successful clusters. I hope you're going to stay with us for the happy hour, but first we have one more speaker joining us from Mexico, Rocio Prado. Welcome.
Thank you very much. Thank you to everybody. Can we see the presentation, please? Okay, so what we're going to speak today, first of all, I want to introduce you to Sintonía. Can I see the presentation, please?
There we go. Presentation is coming. Wonderful.
Next slide, please. Next. Okay, so Sintonía is an institute of collaboration and competitiveness, and it was founded in 2012. And our goal is to boost competitiveness through a clustering strategy using a shared value proposition. Next, please. So the Social Progress Index is a new way to define the success of our societies, and it is a comprehensive measure of real quality of life independent of economic indicators. Next, please. So this is the Social Progress Index, and it measures the extent to which countries provide for the social and environmental needs of their citizens. So how it is calculated, we have 3 dimensions which are shown with the orange arrows, and there are 4 components that are the green ones. Next, please. So here is the map of the Social Progress Index for the world. Now you can see your country, how it's doing in social progress, and the darkest ones are the ones that are doing better. Next, please. So we ask ourselves when COVID-19 arrived, how can we help with the 2 main things that we work in Sintonía, which is the clusters and the social progress. So we ask ourselves, can clusters save lives? Next, please. So the COVID-19 arrived in March, and this is how it has been going through the months until September. Next, please. So we chose a group of Latin American countries, and we started to see how pre-existing health conditions were, and we find out that 10% of the country is older than 60 years old, but which is very good. We are a young group of countries, but Mexico, for example, has the highest percentage of obese population. So we started to find out that pre-existing health conditions for Latin America were not very well. Next, please. And here is a comparison of the Social Progress Index and 2 of their components, health and well-being and nutrition and medical assistance. So we could see that Chile and Costa Rica were doing better. Next, please. Next, please. Okay, so what we did was to divide the components, and we chose some of the components of the basic human needs and some of the components of foundation and well-being, and we're showing them with the green arrows. Next, please. So here is what we find out. So every county is separated in different areas, and we have evaluated access to running water, to mobile telephony, to electric power, and to infectious disease, deaths caused by infectious disease, and many other components in order to see how the countries of Puebla state were going to respond to the COVID crisis. So these are the numbers of May, but we have been doing this study from March to August. Next, please. Next, please. Thank you. So we have here a map. We created a map in which we assign and thought that would be better for municipalities in brown to be helped by the municipalities in blue. Next, please. So here is a map. In the left side, we can see the social progress index of all the municipalities of the state of Puebla. And in according to this qualification, there were 5 important risk areas that were identified in the state due to their lack of resources for the prevention and fight against the disease. And on the right side, we have the counties that in May were already infected. Of course, right now everything is infected. Next, please. So another thing to find out along the study was that the COVID was traveling through the transport infrastructure. It is because of it is an external virus. And next, please. So as conclusion regarding to prevention resources, there is a big need to adapt the message to the real condition of the municipalities. And this is because some of the municipalities have does not know how to read, or some other municipalities does not speak Spanish. And we also ask the risk zones to be isolated. So this type of analysis was done from the end of March until the end of August, when all of the countries were infected and no more strategies for prevention were practicable. And after that, the study was switched to lethality in order to find if a component of the social progress index could cause or influence lethality in the most infected countries in Mexico. Next, please. So this is the country, and now we went national. Next, please. So what we found was that some of the components were really influencing the lethality. And for example, running water and access to information and communications, when they were higher, there was less lethality. Next, please. The same for nutrition and medical care and health and wellness. Next, please. So finally, the social progress index, if it is better, we will find less lethality. Next, please. So we are still looking for alliances and collaborations between government organizations and business people in order to cope with the crisis. But the most important is that we are including also population in general. Real collaboration of each member of the tetrahelix can help, but each member of the society is becoming still more important. The virus is the same, but the country is not. And that is very strong for us. So maybe we are naturally called to be a better society, to collaborate as individuals and as a group of commons. The cluster approach is the best first step to become a better society, and yes, clusters matter and can save lives. Thank you very much for your attention.
And thank you very much for sharing and really really appreciate the different perspectives that we bring. Now we do have about 10 minutes left, so I would really like to open up for more of a discussion with all the speakers, and be happy to hear any perspectives. Maybe I could just start with a question to Nicola in Australia. And my question is, you have been a cluster manager yourself, and now you're advising others. What advice would you give to young clusters or emerging clusters that want to sort of get the leadership challenge right? And then again, we open the floor for questions to everyone.
Thanks for the question, Christian. I think my experience has been that often clusters don't have the frameworks to actually understand the difference between collective leadership and more traditional hierarchical leadership approaches, because we don't tend to teach that kind of leadership. There are lots and lots of leadership development programs, but they tend to focus on the individual rather than the collective. So I think it's a really important concept to tease out right from the very beginning, the notion of a collective approach to leadership, rather than establishing structures and ways of doing things or ways of working that perhaps are more in line with those more traditional approaches of the past.
Just based on the comments we saw here, I would just encourage you to do more writing and more speaking on this, because it is a underdeveloped area of cluster management. Absolutely. Now we can take any questions or any comments for anyone right here.
If you like, Christian, I can just comment also on what Nicola just said. I think in the last weeks, if I just speak from my personal experience here and from the cluster, that what we have been doing has been very in a very flexible way, saying, okay, what do we want? We want to connect with others across Europe, across Spain, across the regions. And how do we do that? We reach out and we give the others the space to talk to us, to talk with us, and together to develop solutions. And we have then created a regular meeting space and a regular exchange platform. And everybody has the opportunity to propose ideas and to propose actions, and to have the freedom to work on these actions and to share with the group, to bring best proposals for best practices. And this gives the opportunity also to others to adapt, take these ideas and implement it into the daily work. And in the last month of the activities we have been doing, I think we've been learning a lot from each other, from other clusters across Europe, but also from other entities, on being flexible, being in that sense also resilient to the changes and to acting quickly. And I think that has been one very good lesson and also benefit, to just reach out and find together spaces to work together and to create a common group identity and work together for also negotiating all the activities along the way.
This is a good point, Nina. Thank you very much. Maybe I can have
I just would like to add something, Christian, if I can.
Of course. Please go ahead.
Thank you. I would like, yeah, thank you. I would just like to say that it's very important for us as leaders of change to do things not only from the professional part in which we are working with clusters as organizations. We also need to have the natural clusters, the no organizations, in order to lead change, to help people, and to help them in collaboration, and to teach them the culture of collaboration. Thank you.
Yeah. Could you maybe give an example of how would you do this in practical terms based on your context in Mexico?
Yes, for example, what we did with this study was showing to the government these numbers and the very big crisis that we were gonna face. And they told us, well, what can we do? And we explained them how to create strategies along with the church, with several organizations, with all the citizens, and along with government to work together. And there is a lot of leadership needed here, and it was not hard. We don't always have big leaderships, and especially in Mexico, I think right now we have a crisis of leadership even in the government at the national level. But some wanted to work, some understood this thing that just my colleague said about no ego, better eco, and few persons learned that, and we could work and help some people, not all, but others are starting to listen.
Yeah. Maybe I can have the final question going back to Moscow and Faina. I was very impressed with your presentation. Could you share a little bit about sort of the financing? How much of your cluster work is public financing, and how much of it is private financing? What does that look like?
It is commercial secret at all, but I can say that our project it is a project of government of Moscow. So I would say that government of Moscow, not government, maybe Moscow, is key investor in our project, and the IMC Foundation, International Medical Cluster Foundation, where we work, is a governmental organization, but we have in all our projects, I mean not projects, in all clinics, for example, Hadassah, Israeli Hadassah, or French Orpea, or Korean Bundan, we have some part of governmental investments and some part of private investments, and it is different from case to case, but the common scheme is the same, governmental and private investments.
No, I mean that was more than good enough with the time we had, and as Bianca Dragomir touched on, and others have touched on as well. I mean that is really one of the questions that many clusters are looking at, like how do we continue to grow, and what kind of financing models and what kind of business models do we have to enable that. So Faina, thank you for sharing, and it's an impressive story you're sharing today.
Thank you very much. It was very interesting to hear cases about experience in other countries, because in Russia we have not so long experience in cluster management, and it's really very interesting to hear more experienced I mean more experienced cluster managers. Thank you.
No, thank you. And you know, normally at this time of the day, or for Nicola Watts in Australia at this time of night, we would be having a few beers, we would be having a few bottles of wine, somebody would be dancing, somebody would be drinking too much, and somebody would fall asleep in the bar. But we have to go back to the main room to sort of introduce the soft closing before we go to the happy hour. So thank you everyone for joining this session. Regardless of your time zone, thank you for dialing in, and then we all go back to the main room, and then Patricia is going to help us close out the conference. Thank you very much.
Thank you, Christian.
Thank you very much.